Welcome to Pharm Mini number 11, where we'll talk about immunizations. Immunizations or vaccines are medications that are developed to help the body produce antibodies to specific microbes. In the past, it has been used to eradicate some diseases such as polio, or it may prevent the individual from getting the infectious disease that's still present. It is made from either a killed virus or a live attenuated virus. Just to note, those that have a compromised immune system can only get vaccines that were developed from the killed viruses. The purpose of vaccines is to increase different types of immunity. So when we look at immunity, we can break this down to two different things, passive and active. With passive immunity, it is temporary immune protection through receiving antibodies from another source. So passive natural would be through placenta or breast milk, whereas passive artificial would be through immunoglobulins. So vaccines do not increase the type of passive immunity. It does, however, increase active immunity. So active immunity is when the immune system produces antibodies that bind to antigens to initiate an immune response. Active artificial would be through vaccines, whereas active natural is from natural exposure to the antigens outside of the vaccine. Some contraindications for vaccines is mainly having a prior reaction to vaccines, in particular anaphylaxis. There used to be a rule that if someone had anaphylactic allergy to eggs, they could not receive vaccines. Now we do allow people with an egg allergy to receive most vaccines. However, we do have to monitor closely after administration. As I mentioned, those that are immunocompromised should not receive a live vaccine, and those that are severely ill should not get any vaccines until their condition improves. If someone has a minor illness or a cold, they can still receive a vaccine. That's not considered a contraindication. Common side effects of all vaccines is going to be tenderness, redness, swelling, and pain at the injection site. So we would want to educate the patient to move that arm frequently if it's given in the deltoid. And we would also want to administer it in their dominant arm because they're more likely to move that arm, and that kind of helps with some of the pain. Other side effects is we can see development of fever and chills, as well as fatigue. As far as recommended immunizations go, we break them into childhood series and adult needed vaccines. So for the childhood series, we can give the DT-TAP, which is for diphtheria, tetanus, and acellular pertussis. The Tdap, which is for tetanus, diphtheria, and pertussis. The TD, which is for tetanus and diphtheria boosters. The HIB, which is for Haemophilus influenzae type B. The RV virus, which is for rotavirus. IPV is for inactivated polio virus. The MMR is for measles, mumps, and rubella. Varicella. PC13 for pneumococcal conjugate vaccines. Hepatitis A and B, seasonal influenza vaccines, meningococcal vaccines, and HPV, which is for the human papillomavirus, also called the Gardasil shot. While we assume that adults have received a lot of these childhood vaccines, that's not always the case. So some may be given in adulthood, and some may just be given as boosters or recommended after certain ages. So in adults, we can give the TD or the Tdap, the MMR, the varicella, the pneumococcal, hepatitis A and B, influenza, meningococcal, HPV, and Zoster vaccines. To break them down, the diphtheria, tetanus toxoid, and pertussis, or the DTP, is a vaccine that we give in children. So the DTaP is given at 2, 4, 6, 15, and 18 months, as well as at 4 to 6 years of age. The Tdap is given between ages 11 and 12, and then the booster is given every 10 years after. We do also give the TD booster to women that are between 27 and 36 weeks gestation. Adverse reactions to this vaccine in particular is a high fever greater than 105 degrees Fahrenheit that can develop within 48 hours, seizures which can develop within 3 days, acute encephalopathy, Guillain-Barré, which develops within 6 weeks, and inconsolable crying for about 3 hours that can happen within 48 hours of getting the vaccine. Then we have our Haemophilus influenzae, our influenza vaccines as well. So the Haemophilus influenzae is given at 2, 4, and 6 months, as well as between 12 and 15 months. And the influenza vaccine is given annually for all children over 6 months, and it is safe to give in pregnancy. The adverse reactions of the live vaccine is that it is contraindicated in those less than 2 years of age and greater than 50, as well as in pregnancy. For the inactivated vaccine, we can see a hoarse voice, headaches, Guillain-Barré syndrome, and seizures, especially when we're giving this vaccine at the same time as a DTaP or a PVC12 vaccine. Then we have the inactivated polio virus. This is given at 2, 4, 6 to 18 months, as well as 4 to 6 years, and it should be used with caution in pregnancy. The main adverse reaction would be anaphylaxis, so we cannot give this vaccine to anyone that has an allergy to neomycin, streptomycin, or polymyxin B. Those are different medications. And we have the measles, mumps, and rubella, or the MMR. This is given at 12 to 15 months, and then again between 4 and 6 years of age. It is contraindicated in those that are pregnant, those born before the year 1957. This is the one vaccine that we would have contraindicated if they do have an allergy to eggs, as well as to gelatin or neomycin. They cannot receive an MMR if they have received a blood transfusion with antibodies in the past 11 months. And we cannot give this on the same day that we do TB skin testing. Adverse reactions would include joint pain and stiffness, febrile seizures, low platelet count, transient thrombocytopenia, deafness, and brain damage. The varicella vaccine is given between 12 and 15 months of age and 4 to 6 years. It is also given after, or if it is given after the age of 13, you do have to have at least 4 months in between doses. It's contraindicated in those that are pregnant, have cancer, an allergy to neomycin and gelatin, HIV, a congenital immune deficiency, or anyone taking immunosuppressant medications. Adverse reactions to the varicella vaccine include seizures, pneumonia, low blood count, and severe brain reactions. And we have our pneumococcal vaccine. This can either be created conjugate vaccine or as a polysaccharide. It can be given at 2, 4, and 6 months, as well as between 12 and 15 months. If we do give it out over the age of 65, we would give doses that are 6 to 12 months apart. We only give it in adults that have only had 1 dose or lack immunity to this virus. Adverse reactions are not very severe with this vaccine, but it is contraindicated in anyone that has an allergy to diphtheria toxoid, those that are pregnant or less than 2 years of age, if they're getting the one that's not made for infants. Then we have our hepatitis A and B vaccines. For hepatitis A, it's given to children between 12 and 23 months, with the second dose given between 6 and 18 months. In adults, if we give the hepatitis A vaccine, we can give it 6 to 12 months apart or 6 to 18 months apart in those that are immunocompromised. The hepatitis B vaccine is given in children within 12 hours after birth. They do get a second dose 1 to 2 months later and a third dose between 6 and 18 months of age. In adults, they would still need the 3 doses. So we would have 1 month between the first and second dose, 2 months between the second and third dose, and there should be 4 months between the first and third dose. Adverse reactions are rare, and typically any reactions that they have are going to be the typical reactions that we see with any vaccine. Contraindications to hepatitis A vaccine is having an allergy to latex or being pregnant. And any contraindications to the hepatitis B vaccine is having an allergy to yeast or in infants less than 5 pounds. Then we have the meningococcal vaccine, or the MPSV4 or MCV4. This is given at 11 to 12 years, and then they receive a booster after the age of 16. This vaccine may be required also to attend some colleges and universities to reduce the incidence of meningitis. We do re-immunize every 5 years for those that are high risk for infection. And as far as adverse reactions go, we don't usually see anything outside of what we would see with normal vaccine reactions. And we have the human papilloma vaccine, or the HPV vaccine, also called the Gardasil shot. So this schedule is given 2 doses prior to the age of 16, 6 to 12 months apart, or if they receive the vaccine after the age of 16, they will receive 3 doses with 4 weeks in between the first and second dose, 12 weeks in between the second and third dose, and 6 months between the first and third. The main adverse effect is it can cause fainting, and it is contraindicated in pregnancy and those with a yeast allergy. Then lastly, we have our Zoster. This is given 1 time for those over the age of 60. There's no typical adverse effects or side effects outside of the normal symptoms of a vaccine, and it is contraindicated in those that are pregnant or have immunosuppression. And that wraps up our Pharm Mini on immunizations.